Thank you for this very important honor. I'm truly honored. It clearly takes a village to create and maintain a robust palliative care program. And I've been fortunate enough to work with many other excellent villagers. My first village was my oncology community. My first village was my oncology community. I always thought palliative care should be part of usual oncology. And I've tried to maintain my oncology credentials as a breast cancer doctor and rural cancer outreach doctor to maintain credibility with my peers. Hopefully we could improve pain and symptom management, serious illness conversations, things like that. We have made slow but sure progress thanks to pioneers like Jamie von Rowan, David Weissman, Charles von Gunten, Eduardo Brera, and newer experts like Jennifer Temmel. Back in the early 1990s, we were actually able to get palliative care added along with a rural cancer outreach program to the National Cancer Institute requirements for being a comprehensive cancer center. Then in 1993 or so, I was able to join the first cohort of the Project on Death in America faculty scholars. You'd recognize all the names: Susan Block, her late husband Andy Billings, Diane Meyer, Charles von Gunten, Sean Morrison. This clearly cemented me into palliative care, and a number of us were able to continue to lobby the American Society of Clinical Oncology for more palliative care research and training. My next group of expert village makers was at Virginia Commonwealth University's Medical College of Virginia in Richmond. I would include clinical specialist nurse Patrick Coyne, a true expert, Brian Cassell, Marianne Hager, James Shaw. We were able to parlay our palliative care consult service into one of the U.S.'s first palliative care units. From the very beginning, in our first foundation grant, we were able to show better outcomes, less distress, better symptom management, offloading of the ICUs, and even substantial cost savings. We eventually got a front page story on the Wall Street Journal back in 2004. Hospitals find new way to save money, take better care of people. We morphed that into better care at a cost we can afford. My wife, Dr. Joanne Bedurtha, and I were at MCV VCU for 28 years, and we built palliative care into every oncology service, including bone marrow transplant. My last 13 years have been here at Johns Hopkins, where I was recruited to advance a cancer center and system-wide palliative care program. The first year I was here, 2011, the team had a total of 400 visits, all in medical oncology. Now we see 12% of all inpatients have a daily census of well over 100 patients and are welcomed everywhere in the hospital. And again, we showed in our second fiscal year that we saved the health system $3.4 million. I have great colleagues here: the late Terry Langbaum, Rebecca Assackson, Rob Razak, Serena Eisenberg, Suzanne Nesbitt and Julie Waldvogel, our pharmacists, and Michelle Churchill and Dr. Danielle Doberman have greatly expanded the program in the past few years. Now we can have up to 15 doctors, 7 APNs and PAs, 3 pharmacists, 3 social workers, and our very own chaplain. And we've completed at least 3 or 4 R01 funded studies with Betty Farrell, Rebecca Assackson, Dr. Fabian Johnston, and the late Chao Sing-Ye and colleagues at Hopkins School of Nursing. I learned a most important phrase from Diane Meyer early on: mission alignment. Make sure you excel in clinical care, education, research, and for heaven's sake, don't cost the health system too much money. And that's still the winning argument. The list of people to thank and acknowledge is way too long, from the early pioneers to continued mentoring from Diane Meyer, Betty Farrell, and others. Like I said earlier, it really takes a village. Finally, I would like to thank the love of my life, my wife, Dr. Joanne Bedurtha, for sticking with me, and our daughter, Anna Jo Bedurtha Smith, a gynecologic oncologist at the University of Pennsylvania, who knows an awful lot about palliative care. Words of advice: take care of yourself. Get mental health help if you need it, and many of us will in our lifetime, like me. Get involved in a project in an under-resourced country, and keep interested, especially in science and clinical trials. We should all have at least one mad scientist project going at all times. Mine has been scrambler therapy, which is finally being widely accepted. It is the most amazing pain relief system I've ever used. Again, many thanks for this wonderful honor.